I'm really pleased, Rebecca, that we've been able to chat about this subject. So thank you so much for joining me this afternoon.
Oh, no problem at all.
And I know this is kind of, birth trauma is kind of an expertise of yours, really. So would you mind just introducing yourself and kind of what you do in your day-to-day work, I suppose, for everyone who's listening?
Yeah, sure. So I'm a consultant perinatal psychiatrist. So that means that I work with women through any stage of pregnancy and up to a year postnatally with any kind of mental health issue. And I'm also one of the co-founders of Make Birth Better. So that's a national collaborative that aims to reduce birth trauma by campaigning, being involved in research and training as well, a lot of training.
Amazing. And the work that you do is just so important to women and their mental health and their well-being. So I guess from a midwife's point of view, thank you for all the campaigning that you're doing and raising the awareness. It's so important and valuable. And I suppose to start with, Rebecca, it's really useful to explore what birth trauma is, because I know it quite often gets mixed up with other terms like post-traumatic stress and postnatal depression. So would you mind just kind of clarifying, I guess, for us all, what birth trauma actually is in terms of its category?
Yeah, of course. I think you're right. It is really confusing and you can see lots of different terms being used. And I think that's really hard if you're a woman trying to kind of navigate, where am I? What does this mean for me? I think really, birth trauma means subjectively your story, something about it felt difficult for you. And that can be not just during birth, but in your pregnancy or postnatally as well. And, we could really replace the word trauma with, feeling fearful or overwhelmed or out of control or distressed. So then if you've had a difficult experience during your pregnancy or birth or afterwards, then after that you can go on to experience a range of different feelings. And then sometimes if we have a checklist of a specific set of symptoms, then you might be formally clinically diagnosed with PTSD. But PTSD doesn't equal birth trauma, because you can have, PTSD, essentially you need to fulfill a set of symptoms, but you might have most of those symptoms and not have PTSD, but still be really traumatized by your birth. So in reality, everybody's sort of on a spectrum. And in some ways, it doesn't really matter, because what really matters is how can be really, really helpful.
Yeah, and I love that, because I think sometimes with specific diagnosis, you're very kind of boxed off and categorised. And with birth trauma, it's not that, and it's very individual for that woman, isn't it? And if she feels like there's been an aspect of any of her pregnancy or birth journey that has made her feel out of control or traumatised, then she's got a birth trauma. It doesn't have to be you feel this way at this time and you've got these specific symptoms.
No, I completely agree. I mean, sometimes it's really helpful to be able to say to somebody whether you have an actual PTSD or not. And some people like to have a diagnosis, but actually it doesn't matter, because what matters is your story and how you feel. And then what matters from there is what we do together to think about ways to heal and feel stronger and feel better. So, in reality, we aren't neat boxes. We're all unique, and our treatment needs to be unique as well.
Yeah, that's so important, isn't it? So important. And am I right in thinking that around a third of women could be actually impacted by birth trauma that we know? But with all these kind of mental health, statistics, we're always cautious that we might be slightly underreporting, especially with stigma and things like that around birth trauma, that women may not be speaking out. So actually that could be significantly higher, I suppose.
Yeah, I think that depending on what study you look at, some studies say 20%, and that definitely seems to be fairly consistent. But then there was a really big study from last year that said 40%. Yeah, wow. So, I think it probably is more common than we know. And I think, for a big group of women, that is probably something that then fades fairly quickly, perhaps. So perhaps they have a milder form of it. But I think, the key thing is that this is something that's really common. So we need to get much better at knowing how to assess for it and how to recognise it and how to support women as well.
Yeah, most definitely. And I think from my perspective, Rebecca, so I work on a delivery suite, so high risk unit, and I think quite often when people associate birth trauma, they think there must have been something in their birth that was perhaps a rushed forceps delivery or an emergency cesarean or an emergency buzzer and loads of people ran in the room. But actually, when you speak to women and you unpick what was traumatic to them, quite often it's not those kind of alarming events, but actually it's the way they were spoke to, the way they were touched or communicated with, or a lack of proper informed consent in their care that actually triggers a trauma, perhaps more than what we might think, oh my goodness, that was a really chaotic situation for that woman, she's bound to be traumatised. But actually it's that almost sometimes accidental lack of compassion and kindness, I suppose, that can actually trigger trauma.
Yeah.
Oh, we just lost you there.
So third. Oh, did you? Sorry.
That's okay.
Can you hear me?
Yeah, that's
Can you hear me now?
Back.
So most of the evidence we have is that it's thirds, really. So, a third of it is because there is some kind of medical emergency. And I think what's important about that is that it doesn't have to be an actual medical emergency. It's if the woman thinks it's an emergency, and that often stems from miscommunication as well.
Yeah.
And a third of it is very much around interpersonal skills. So it's how you're made to feel, whether you feel alone, whether you feel uncared for, whether your pain requests feel dismissed. And then a third is sometimes around thinking that something is going to happen for the baby, or it might be that the baby has had to go to NICU, or there's been some issue with baby after birth. And for most people, it's a mix of all three. It can have people that, on paper, like they've had a very quick, straightforward vaginal birth, that walk away feeling really, really traumatised. And you can have somebody who has, emergency cesarean with a postpartum bleed that doesn't feel traumatised. And I think the difference is usually a human person who has made the difference, who has been with them, been kind, held their hand, explained what's going on, involved partner. So the difference we can make is massive. And that's why I'm always, really keen to say to midwives and student midwives that you have a massive role here, because do not underestimate what those tiny gestures of kindness and humanity do in terms of trauma. They are absolutely massive.
Yeah, that's really important, Rebecca. And that's part of the reason I love listening to some of the collaborations that you've done with other people. Is it is those small things that we can do, and that might be holding a woman's hand or just helping her to breathe through something that's difficult. And then I think really important, especially if there has been an event that has been quite stressful, is debriefing women as soon as possible and making sure they've got plentiful opportunities, because sometimes women, certainly in my experience, immediately think, oh no, it's fine, I've got my baby now and we're both healthy. But then perhaps the next day or weeks and months down the line, or sometimes even when they fall pregnant with a subsequent child, that's when kind of feelings and things really start to trigger and come back to the forefront, I suppose.
Yeah, and I think the thing with debrief is, it very much depends who does it and how they do it and when they do it. So, a lot of women do get offered debriefs, but they're not necessarily helpful for everybody. So sometimes even, being asked to go back to the same hospital is too traumatic. People can't even get into the entrance of the hospital. So that can be really, really difficult. But I think, there is a place as midwives just to be checking in with people in those few days on the postnatal ward or in the community. And, the amount of women that are never really asked how their birth was, it just becomes, are you feeding? Are you still bleeding? Going to use reception? And then mum has no space to say, well, actually, I can't really stop thinking of my birth, or felt a bit out of control. And for many people, just actually actively listening and hearing their birth story is a treatment in its own right. Just being able to actually give them the space to talk through it. Yeah. Or I always encourage people, if they can't say it yet, to write it down, because there's actually quite a lot of good evidence that journaling is really helpful in reducing trauma memories. So, if you can't say it yet and you feel able to write it down, just write out your birth story. But, we really need to get better at sort of giving women space to tell us these stories and to really listen, not to be telling them what we think, but just to be hearing, and that is so powerful for women.
You're so right, Rebecca, and the power of listening, I think, goes really, really underestimated. Especially with kind of, I guess, postnatal checks on women tend to come from a very medical perspective, in that we check their blood pressure and we check their breasts and we check their bleeding and their stitches and wounds and things like that. And we might say, and how's your mood? Oh, I'm tired, or I feel down, or but you've got a new baby, and it's all kind of minimised. But there's not an open question about, so what happened with your birth? How do you feel about your birth? And I think those open-ended questions are really important and need to happen more often. And with mums and dads or birth partners or whoever else was present in supporting that woman.
Yeah.
Because it can be quite traumatic experience for other people in the room as well, can't it?
Yeah, I mean, birth trauma can affect anyone in that space. So we know it affects dads as well. We know it affects medical professionals in the space as well. And if we're bad at detecting it for women, we're even worse at detecting it for dads on the whole. And even now there is a birth trauma scale. It takes as much time to do as the EPDS. It's one page, so even if time is an issue, you could leave this with the woman, get them to start filling it out, and at least it promotes a discussion and thinking about it. So there are lots of different tools. I know that often people are really pressed for time, and they feel like, I haven't got time to ask this question. But we should never not have time to be able to just gently start that conversation.
Yeah, absolutely. And I guess and it's a part of the mental health screening. So we seem to put lots of emphasis on screening for postnatal depression, but birth trauma should be part of that tool, I suppose. And the same things that we do to screen for postnatal depression, we should be incorporating that to screen for birth trauma, because we know that can lead on to depressive symptoms for mums as well. So it's kind of precedes postnatal depression perhaps for lots of women, and we could pick that up sooner.
Yeah, and I think it's so missed and hidden for a lot of women. The narrative is just, you've got this baby, you should be grateful, aren't you clever, you've got a beautiful baby, and that's all true, of course. But what it does is silence women, and often that is also happening within the family. Of this is just what happens. This is what happens when you have a baby, and and that's not just what happens when you have a baby. That isn't how it should be. And sometimes women have got physical birth injuries as well, so they really need to have a space to be able to start to explore this, because it can cause long-term problems, and trauma can be held for a very, very long time. And every time I give a lecture, someone comes up to me at the end and talks to me about their birth story. And sometimes it's 25 years ago, distressed, so it's really important that we get this right, because actually the treatment works really, really well. Yeah. So, we have a treatment there that is really good. So I just don't want women to be suffering when they don't need to be.
And that's a really powerful message, actually, isn't it? There's lots of women suffering in silence that they really don't need to be. There's really is things we can do that are proven to work and to improve their mental health and quality of life. And so what sort of things, Rebecca, would you recommend that mums, but also partners and dads, look out for in terms of signs and symptoms that they might be suffering from a birth trauma? Because sometimes it's quite difficult to recognise in yourself, isn't it?
Yeah, I mean, it's really unique. You can have a whole range of symptoms, but I think with trauma, it's often about a birth that you feel you can't move beyond. So your birth is just with you all the time, whether you're thinking about it all the time, you're replaying it in your thoughts, in your dreams. You feel on edge all the time, you can't relax, you think that something else bad is going to happen to you. And alongside that, you may feel that you can't think about it because it's just too much, or you don't want to talk about your birth, you don't want to go near a hospital, you don't want to see pregnant friends, you just can't bring yourself to talk about it. There's often anger, irritability, you can get affected sleep, but I would say it's really that kind of feeling stuck around your birth. So perhaps you just want to talk about it all the time, or you feel like you're back there again, or you're reliving it, or you might even feel it sort of physically, or have sort of visual images like a film of certain moments or certain things that people said to you. So, it's a really, really scary set of things to be juggling while you're also trying to be a new mum. And sometimes it can be very difficult with baby, because baby is a reminder of what has happened. So you might feel disconnected from baby, or a bit detached, or sometimes it can be the other way around, that you feel you have to check baby all the time, or you don't want anybody else to touch the baby, or you're the only one that can look after baby. So, trying to navigate all of that whilst you're a new mum and you're tired and you're recovering is really, really hard. And I think sometimes it can take time to kind of tease out, especially if you're a first-time mum. But after all births, is this normal? Is this being tired? Is this more than that? And I know that that's something that sometimes can be really hard to navigate. So there are some really good checklists. There's one on the Make Birth Better website, and also one on the Birth Trauma Association. You can kind of tick off, am I experiencing this, and this? And it can just help you to maybe, take that to your health visitor or your midwife or your GP, and just start a discussion about, look, I think quite a few of these things are actually happening for me.
Yeah.
What might that mean? What might I do? But it's just a good way to sort of start that conversation.
Absolutely. And that tool is fantastic. I'll put that onto my Instagram page for mums to have a little look at, because sometimes approaching these conversations can be the most difficult bit, and it can take a lot of courage for women to actually say, I think something's not quite right here. And so sometimes having, I guess, an advocate with you, so someone that you trust to come along with you to start those conversations, can be quite useful. And like we spoke about earlier, is writing things down. That can be really powerful. If you don't feel like you can vocalise it, actually having your feelings written down and presenting that to a healthcare professional is absolutely fine if that's what you feel is the most comfortable way for you to communicate. Much better you do that than kind of suffer in silence.
Yeah, absolutely. So write it down, take somebody with you. We lost you there.
Yeah, we lost you again.
Sorry, lovely. It's
right,
jumping around for me.
The joys of technology.
I'm going to try and move.
No problem.
The perils of working at home. Oh, it's a nightmare. Can you hear me okay now?
There we go. Yeah, we can hear you.
Yeah, so I was just saying, I completely agree. If you can write it down, take somebody with you. Some GP surgeries have a perinatal champion who is a bit more switched on about perinatal mental health, or if there's somebody that you kind of instinctively feel like you kind of click with or trust, try and book to see them. I think it is probably the most courageous thing you do is to go and tell somebody, because everybody feels frightened that they're going to be judged, or that they're a bad mom in some way. And we know that so many women don't ever disclose about how they're feeling. So it is really courageous to do that. And I think also we have to accept that sometimes perhaps you don't get a good response the first time, unfortunately. So you may have to go back again, you may have to take somebody with you. But I think, there are lots of people out there that will really hear you and will really support you.
Yeah.
And, you mustn't being judged, because nobody is there to do that. It's all about trying to support you to feel well again. And don't be afraid to see somebody else if you don't feel click with the first person, or you don't feel that they're listening to you.
That's really important, because I think people generally go into a healthcare profession with the best intentions and with the want to care. But I do think that sometimes, especially when it comes to, I guess, mental health and things that aren't quite as well known, like birth trauma, it doesn't always, they're not always getting the best support, I suppose, and the response that is optimal. And it's not unusual for women to be experiencing birth trauma but being treated for postnatal depression, because the healthcare professional can't quite recognise the difference, I suppose, and the different support that's needed. That it can just be, you're feeling these kind of depressive symptoms, you're perhaps not bonding with your baby and not sleeping, it must be postnatal depression, here's some pills, and off you go on your way. And I'm not saying medication isn't always a good treatment for some individuals, but for many women, actually the talking and the support and the unpicking of events that have happened is what they need before that, perhaps.
Yeah, no, absolutely. I mean, and I think, lots of women do tell us that they go with a trauma story and end up being told they're depressed when they know that they're not in reality. And I think, that's really hard. And sometimes you will have to go back again. Or, sometimes people find support first via a peer forum, and that can be really, really helpful, because it can kind of give a name and a voice to what you're experiencing, so that then you feel more confident going to see the GP. Because you can kind of know what you want to say. So I think peer group forums can be really, really helpful, and there's some amazing ones online. And sometimes people won't see a professional, and that is also fine. It is fine to get your support online or from helplines or by journaling or by going to yoga. It is absolutely fine to go down all of those routes. I think, what I want for everybody is, I don't want everybody to follow one route, because we're all unique and beautiful and we're all going to have our own story. But what I wanted everybody to know all the choices. And I think, that's often what women don't get. They, like you say, just get given a prescription, or they just get told to refer themselves to IAPT for therapy. But what really I wanted is for people to know that, there are lots of different ways from trauma. So it's about thinking, I'm going to do that and that. And for 5 women with birth trauma, they will all have their own unique story, will all choose different things to heal. Yeah. And that's, I think therapy for many people is a great starting point and can often be really, really helpful. But again, it's about being able to access that, being able to get somebody who's a trauma specialist, and you have to have that kind of click of relationship with somebody. Yeah. So, therapy unique for everybody, but the message is very much that you can and will heal, but you just need to get the right supports in place.
Yeah, definitely. And we do all heal differently, so that combination for one individual is never going to be the same for another. And the other thing, Rebecca, that I really wanted to chat with you about is there's lots of focus, I guess, in the antenatal or preconception period about preparing women physically for birth. And birth planning and things like that. But I wonder whether we lack somewhat in preparing women emotionally for birth, and whether that could also have an impact on experiences with regards to birth trauma. And also, I wonder whether some antenatal classes aren't giving a kind of, I guess, realistic expectation, which almost leads women to feeling these feels of like they failed at birth, or they're disappointed with their birth outcomes, which are, as a midwife, that massively saddens me, that any woman could possibly feel like they'd failed at labour or birth when they have grown and created this human. But I think that sometimes we almost set women up with these really unrealistic expectations. Do you think sometimes that can lead on to kind of, I guess, maybe a slightly increased risk of experiencing birth trauma?
Yeah, I mean, I think getting antenatal education right is the big question for how we do this better for being trauma-informed, because I think we're not, we hear about the term trauma-informed a lot. It's kind of a buzzword, but I think in reality most services are not yet really aware of what that means and how you would quite do that. And we haven't yet got continuity of care for most women throughout their pregnancy, which would be a massive help. And I think antenatal care provision in the NHS has really been decimated for most trusts and women. So perhaps you're getting 2 or 3 sessions in big groups, which then doesn't really give you a space to kind of really talk about your concerns. But I think there is definitely needs to be a focus on how to prepare women for birth in a way that is realistic, in a way that informs women, in a way that informs women. And I think there is nothing wrong with having birth preferences. I would prefer to call them rather than plans.
Yeah, absolutely.
But you also need to think about the plan B, D, E and F, and I think that's often what's missing. And I think, for example, we don't really talk to women about the difference between vaginal birth or cesarean birth, about the risk of injury. And often I hear women say, I would have made a choice if I'd known more about the consequences of forceps or cesarean, and I think women a great disservice thinking that women cannot have this information and make their own mind up. It feels so patriarchal to kind of say that, we can't tell the women this because it will be too much for them. Really? I mean, women are perfectly capable about making minds, and I think we need to have these discussions beforehand, and I really encourage with their partners the whole time, because sometimes also we really need partners to step up and advocate for us, because we are going to be in pain, we are going to be tired, we may not be able to process and make decisions that we would do normally. I think that if we could move more of a sort of advanced directive thing about consent before we even get to birth, that would be really positive. And I know that there's lots of excitement around the use of the I Decide tool and giving women greater consent and power, and I think that's brilliant, because I think still too often women are told what they do, and that should not be the case. It should not be, you should do this, we will do this. It should be a collaboration. I think that happens, and women are tired, they're in pain. It's very easy to kind of shut down and feel like you have no agency. And then people feel really cross themselves afterwards, or they feel guilty, or they feel to blame. But I agree. I think absolutely we need to get the antenatal bit far better than we do, because that is where we could actually stop a lot of birth trauma from happening. We also need to recognise people that are more vulnerable as well in that group. So people with a history of sexual abuse previously, or prior trauma, we need to be screening for them sensitively in pregnancy and giving that group more support, so that then they are coming into birth feeling really empowered, rather than suddenly thinking about it in the middle of an emergency. That's not the right way around.
I love that. And I think it's important that, like you kind of alluded to there, is that we are so worried about giving women this information about things that perhaps don't quite go down this sort of straightforward path, in the fear of scaring them. But actually these are real interventions that happen for a lot of women, so we're doing them such a massive disservice by not educating them and informing people antenatally. And I like to think of sort of discussing, so this is what happens with a straightforward vaginal birth, this is indications why you might be recommended to have, for example, a forceps birth or a caesarean section, but what can you do for yourself if this was indicated that will make you still feel empowered and in control? And I think if we can get that little bridge right, then actually women understand why this is being recommended, and they feel like that's a decision made in partnership because they've got that existing information, and they know what they can still do that's going to make them feel empowered and in control of the direction that their birth's taking, because we know that labour and birth does have lots of twists and turns, and like you say, we can plan it or make our birth preferences, but these little babies tend to decide what happens more than anything, really.
Particularly those babies. But there are so many things that you can still do to feel in control, but you can't do that if you've never thought about it. Not your fault for never thinking about it. I feel really strongly it's not the only thing woman, it's the onus on us as professionals to have those really complex, difficult discussions. And in reality, they're not even that complex. It's just that we don't do them very well. And so many times, afterwards I sit with women, they say, I never thought that I'd have an epidural, or I never even thought that I'd had a cesarean. And you think, that is wrong.
Yeah.
Have had that discussion beforehand of the what ifs. So that, if that had happened, then you've already got a plan of, in some trusts now you can go to theatre, you can walk around the theatre, you can, so you've been there, you've what it looks like, you can take your own music in, you can have immediate skin to skin, you have a gentle cesarean. There's so many things that can make it feel a positive birth experience for you.
Yeah.
But not if you've never even discussed it.
Absolutely. And unfortunately, when things don't quite go to plan, generally there is a bit of a time scale, because we're acting because there's a concern. So we don't have time to then spend a proper good chunk of time, I guess, going through with women, right, so this birth preference can't work, what should we do? So we need to have had these discussions antenatally. And I do think that empowering women antenatally is where we're really missing out.
Yeah, no, I completely agree. And I think, like say we haven't got the time, because we should make time, because this is really important. Far better to have, a couple of longer antenatal appointments than somebody with a postnatal PTSD who then requires treatment and care, the impact that has for that woman. We need to prioritise this and get it right. It's not so difficult to do, and we missing out on also, what that will bring to the women and her partner. And I think, it would mean much better birth experiences for most people as well.
Definitely. And I guess it's important that we recognise that we can't, I guess, prevent all birth trauma, even with the best preparation and forward thinking in the world. But what we can do, and what we probably aren't doing, to be totally honest, is working in a way that can limit that and reduce it and recognise it. And that's where we need to work, isn't it, moving forwards? Yeah,
I mean, there are always going to be some episodes of birth trauma that, are not preventable. But a lot of them are, and so much of them comes back to kindness and communication and consent and feeling safe. And, these are all things we really should be able to get right. And if we're not able to provide that, then we really need to be teams and thinking, are they traumatized themselves? And in doing so, we've got this loop of trauma going on. And, our teams work unbelievably hard. The pace is relentless. And we know that there's a lot of trauma medical professionals, especially in midwifery and obstetrics. So we need to be sort of also seeing as part of the picture of how we support teams and how they can reflect and how that they can have their own support so that they are able to keep giving and giving and giving.
Yeah, sure, I love that. And I guess, Rebecca, just to kind of finish our session so people can get their lunch, I'm putting you on the spot slightly here. We haven't rehearsed this, so I apologise. But I wondered if there was someone watching who is a woman who feels they have experienced birth trauma but hasn't yet sought help, what would be your kind of top tip to her or him with regards to taking the next steps?
I mean, I think, it's starting to try to voice that, and however you do that. I think the most important thing is who you voice it to. And like I said, ideally, if you have a professional that you really feel safe with, brilliant. But, there are a million ways and resources to talk to people. So it might be your health visitor, it might be your GP, it might be you ring PANDAS, the helpline, it might be you go on Facebook with the Birth Trauma Association, it might be you look at Make Birth Better, and you message us on Instagram. We get people messaging all the time. We can't offer specific clinical advice, but we can signpost people to sources of really good support. So I would say just pick one that you feel is okay and feels safe for you, and don't be afraid to do it. Don't feel abnormal. Know that you'll be listened to and heard, and know that you can get better as well.
Yeah, and that's really powerful, actually, isn't it? That this isn't how it has to be forever, that it can be fixed.
And know that you matter, that you are worthy of that care, you know, that you think about how much love and energy and time you're pouring into your baby. And I want you to feel that you can do the same for yourself. You know, that you both matter, that the whole family matters, not just baby or you, it's baby and.
Yeah, that's brilliant. And Rebecca, I'm so grateful for your time, because the way you discuss the subject and the way you speak about it with women, I think is just makes it seem okay and makes it seem like actually women can get through this. And so I'm really grateful for you taking time to chat with me today, and hopefully we've been able to help some ladies out there.
Oh, thank you. And sorry about the random moving around my house.
It's fine. No problem at all. All right, lovely to chat with you, Rebecca, and hopefully speak to you again soon.
All right, lovely, take care.
All right, take care, bye bye.